Have you ever wondered how much your daily habits influence your risk for serious diseases, especially gynecologic cancers, after 50? Many women believe cancer is caused only by genetics or factors beyond their control. While family history does play a role, research consistently shows that lifestyle choices, what you eat, how active you are, whether you smoke, how you manage your weight, can significantly raise or lower your risk. In fact, the American Cancer Society reports that up to one-third of all cancers are linked to preventable lifestyle factors. That means your habits matter more than you think. And after menopause, when natural protective hormones like estrogen and progesterone shift, your body becomes even more sensitive to the impact of these choices. Hello, I'm Dr. Lisa Perriera. For more than 30 years, I've cared for women through every stage of life. And one of the most important lessons I've learned is this: you have more power over your health than you realize. I've seen women who felt helpless about their cancer risk discover that small changes in their daily routine gave them not just protection, but also renewed confidence in their bodies. Today, I want to talk with you about the 5 habits that increase your risk for gynecologic cancers after 50. By recognizing these habits, you can take steps to change them, and in doing so, protect your health for years to come. Before we dive in, I'd love for you to subscribe to Elder Care Wellness, where we bring you evidence-based, compassionate guidance designed for women over 50. And if you or someone you know has faced gynecologic cancer, I encourage you to share your experience in the comments. Your story may provide hope or motivation for another woman watching today. So let's begin with the first habit: ignoring abnormal bleeding after menopause. One of the most common and dangerous mistakes women make is assuming that spotting or bleeding after menopause is normal or just part of aging. But the truth is, once you've gone 12 months without a period, any vaginal bleeding should be considered abnormal until proven otherwise. According to the Mayo Clinic and the American Cancer Society, postmenopausal bleeding is the most common symptom of endometrial cancer, the most frequent gynecologic cancer in the United States. Around 90% of women diagnosed with endometrial cancer report bleeding as their first warning sign. Ignoring this symptom can allow cancer to grow, silently delaying diagnosis and making treatment more difficult. I remember a patient in her late 50s who dismissed her light spotting for nearly a year. She told herself it was probably dryness or stress. By the time she came to see me, tests revealed endometrial cancer. Thankfully, it was still in an early stage, and surgery offered a cure. But she later admitted, "I wish I had listened to my body sooner." Her story is not uncommon, and it's a powerful reminder that bleeding after menopause is never something to watch and wait. If you notice even a small amount, call your doctor. Ignoring abnormal bleeding is a habit that forms out of fear or denial. Many women don't want to make a fuss or worry their family. But silence is dangerous. If caught early, endometrial cancer has a survival rate above 80%. If found late, that number drops dramatically. Paying attention to your body's signals and seeking medical advice quickly can literally save your life. So the first habit to break is ignoring abnormal bleeding after 50. By taking this warning sign seriously, you give yourself the chance for early detection and effective treatment. In the next part of this video, we'll move to the second habit, one that affects millions of women worldwide and significantly increases the risk of several types of gynecologic cancer: carrying excess weight. The second habit that quietly but powerfully increases the risk of gynecologic cancers after 50 is carrying excess weight. Obesity is now recognized as one of the leading preventable causes of endometrial cancer, and it also contributes to higher risks of ovarian and even cervical cancer. According to the American Cancer Society, women who are significantly overweight have 2 to 4 times the risk of developing endometrial cancer compared to women at a healthy weight. The reason lies in the way fat tissue behaves in the body. Far from being inert, fat tissue actually produces estrogen. After menopause, when your ovaries no longer make much estrogen, fat becomes the main source. And too much estrogen without the balance of progesterone can stimulate the lining of the uterus to grow abnormally, eventually leading to cancer. This isn't just about hormones, though. Excess body weight also promotes chronic inflammation, which damages DNA over time and fuels the growth of cancer cells. It can also lead to insulin resistance, raising levels of insulin and related growth factors in the blood. High insulin levels act like fertilizer for abnormal cells, encouraging them to multiply. So when you combine excess estrogen, chronic inflammation, and high insulin, you create a perfect storm that dramatically increases the risk of gynecologic cancers. I remember a patient in her early 60s who came to me worried about irregular bleeding. She was significantly overweight and had struggled with her weight since her 40s. When we diagnosed her with endometrial cancer, she broke down and said, "I always thought my weight was just about my joints and my heart. I didn't realize it could be the reason for cancer too." Her words reflect a common misunderstanding. Many women know that obesity affects the heart and diabetes risk, but far fewer realize how directly it fuels gynecologic cancers. The hopeful news is that even modest weight loss can make a difference. Studies from the National Cancer Institute show that losing just 5 to 10% of body weight can significantly lower the risk of endometrial cancer. You don't have to become slim overnight or aim for a number you haven't seen in decades. Small, steady steps, like reducing sugary drinks, walking 20 minutes a day, or choosing whole foods over processed ones, help regulate insulin, reduce estrogen exposure, and calm inflammation. Over time, these changes strengthen your body's defenses against cancer. One of my patients once started by cutting out her nightly soda and replacing it with sparkling water and lemon. That single change saved her hundreds of calories a week. Over months, she noticed she had more energy, less joint pain, and eventually lost weight. She later told me, "For the first time, I feel like I'm working with my body, not against it." Her journey shows that progress doesn't require perfection, it only requires persistence. It's also important to approach this topic with compassion. Many women carry shame about their weight, and shame often keeps them stuck. But the goal isn't about fitting into a certain dress size, it's about protecting your health and giving yourself the best chance at a long, vibrant life. Every positive change you make, no matter how small, is an act of self-care. Think of it as tending a garden. Every weed you pull, every flower you water, makes the whole space healthier, even if the transformation takes time. So the second habit to break is carrying excess weight without taking steps to manage it. While genetics and life circumstances can make weight control challenging, the choices you make each day truly matter. By nourishing your body with balanced meals, staying active, and making gradual lifestyle shifts, you lower your cancer risk and strengthen your entire body. In the next part of this video, we'll move to the third habit, a behavior that's surprisingly common, yet often overlooked: smoking, and how it dramatically increases the risk of cervical and other gynecologic cancers after 50. The third habit that significantly increases the risk of gynecologic cancers after 50 is smoking. Many women associate smoking mainly with lung cancer or heart disease, but it also has a profound effect on the reproductive system. According to the Centers for Disease Control and Prevention, CDC, smoking is a major risk factor for cervical cancer, and it contributes to the development of ovarian and vulvar cancers as well. Chemicals in cigarettes, such as nicotine, benzene, and formaldehyde, don't stay confined to the lungs. They travel through the bloodstream, damaging cells throughout the body, including those of the cervix and ovaries. Over time, this damage weakens your body's ability to repair DNA and fight off cancerous changes. One reason smoking is particularly linked to cervical cancer is because it interferes with the immune system's ability to fight off human papillomavirus, HPV. HPV is the leading cause of cervical cancer. Most women's immune systems can clear the virus naturally, but smoking weakens that defense. The result is that HPV infections are more likely to persist and cause precancerous or cancerous changes. The American Cancer Society notes that women who smoke are about twice as likely to develop cervical cancer compared to women who don't smoke. I recall a patient in her mid-50s who had smoked since her teens. She came to me for a routine checkup, and her pap smear revealed abnormal cells. Further testing confirmed cervical cancer. When we talked about risk factors, she said I thought smoking only hurt my lungs. I had no idea it could attack my cervix. Her story reflects what many women believe, that smoking harms the heart and lungs, but spares other parts of the body. Unfortunately, the truth is that no part of your body is spared from the toxins in cigarettes. Beyond cervical cancer, smoking also raises the risk of ovarian cancer. Studies show that carcinogens from tobacco can accumulate in the ovaries, directly damaging ovarian cells. For vulvar cancer, smoking reduces blood flow and weakens the immune system, allowing precancerous lesions to progress more easily. Even if you've smoked for decades, quitting still brings benefits. Research from the National Institutes of Health shows that women who quit reduce their risk of gynecologic cancers over time, and their immune system gradually regains strength to better fight HPV and other threats. Quitting smoking is not easy, especially after many years, but it's one of the most powerful steps you can take for your health after 50. Nicotine replacement therapy, prescription medications, support groups, and counseling can all make the journey more manageable. I often tell my patients, every cigarette you don't smoke is a victory. Even reducing the number of cigarettes each day begins to lower your risk. And the benefits are quick. Within weeks, circulation improves, and within months, immune function strengthens. One of my patients, a grandmother in her 60s, finally quit smoking after her first grandchild was born. She told me, I want to be here for her first steps, her first words. With the support of her family and a structured quit program, she broke a 40-year habit. A decade later, she remains cancer-free and vibrant, enjoying life with her grandchildren. Her story is a powerful reminder that it is never too late to quit. So the third habit to break is smoking. It not only damages your lungs, but also doubles your risk of cervical cancer, weakens your defenses against HPV, and harms your ovaries and vulva. Quitting is challenging, but it is also one of the greatest gifts you can give yourself and your loved ones. In the next part of this video, we'll look at the fourth habit, a silent risk many women don't think about: neglecting regular screenings and checkups, which can delay the discovery of cancer until it's too late. The fourth habit that silently increases the risk of gynecologic cancers after 50 is neglecting regular screenings and checkups. Many women assume that once they've gone through menopause, they no longer need pap smears, pelvic exams, or other gynecologic care. Some feel embarrassed, others are too busy caring for families or aging parents, and many simply believe that if they feel fine, nothing could be wrong. But cancer often grows quietly at first. Cervical, ovarian, and endometrial cancers may not cause symptoms until they've reached more advanced stages, when treatment becomes more difficult and less effective. Regular checkups give doctors the chance to detect abnormalities early, sometimes before they turn into cancer. Cervical cancer is the clearest example. Thanks to pap smears and HPV testing, cervical cancer rates have dropped dramatically over the last 50 years. Yet the American Cancer Society warns that women over 50 who stop getting screened too soon still face real risk, especially if they've had a history of abnormal pap results or are not up to date on HPV testing. Similarly, While there is no single test for ovarian cancer, routine pelvic exams and discussions about symptoms such as bloating or pelvic pressure can lead to earlier diagnosis. Endometrial cancer, too, is often detected through timely evaluation of postmenopausal bleeding. Without these checkups, warning signs can be missed. I remember a patient in her late 50s who skipped her gynecologic exams for nearly a decade. She told me she thought, "I'm done with periods, so I'm done with pap smears." When she finally returned after noticing some unusual discharge, we discovered cervical cancer. She later admitted, "If I'd kept up with my screenings, this might have been found years earlier." Her story is not unique. Too many women unknowingly put themselves at risk by neglecting these preventive visits. The hopeful reality is that screenings save lives. A pap smear can identify precancerous changes in cervical cells long before cancer develops. HPV testing can reveal high-risk strains of the virus responsible for most cervical cancers. Pelvic exams allow doctors to feel for unusual masses or tenderness that might signal ovarian disease. For women with risk factors, transvaginal ultrasound or endometrial biopsy may be recommended to detect uterine abnormalities. When these tools are used consistently, they provide an invaluable safety net. According to the National Cancer Institute, women who adhere to recommended screening schedules cut their cervical cancer risk by more than half. Of course, screenings can feel uncomfortable or even intimidating. Many women put them off because of fear, embarrassment, or past negative experiences. But I always remind my patients that these visits are acts of empowerment, not shame. Taking the time for a pap test or exam is a way of saying, "I value my health and my future." And today, many clinics offer female providers supportive staff and gentler techniques to make the process easier. Bringing a trusted friend or family member along for support can also help. Another common barrier is the belief that age itself eliminates risk. Some women think, "I'm 65, surely I don't need pap smears anymore." While it's true that guidelines allow some women to stop pap tests after 65 if they've had years of normal results, this is not universal. If you've ever had abnormal results, a weakened immune system, or new sexual partners' continued screening may still be important. The key is not to make assumptions, but to have an open conversation with your doctor about your personal history and risk. So the fourth habit to break is neglecting screenings and gynecologic checkups. Cancer does not always announce itself loudly at first, but screenings give you the chance to catch it early when it is most treatable. In the next and final part of this video, we'll talk about the fifth habit, one that many women underestimate: ignoring lifestyle choices, such as diet, exercise, and alcohol use, which together can quietly raise cancer risk if left unaddressed. The fifth and final habit that raises gynecologic cancer risk after 50 is ignoring lifestyle choices such as diet, exercise, and alcohol use. These may seem like small, everyday decisions, but taken together, they have a profound effect on your long-term health. Diets high in processed foods, sugar, and unhealthy fats contribute to inflammation and weight gain, both of which fuel cancer growth. A sedentary lifestyle reduces circulation, weakens your immune system, and increases insulin resistance, which can trigger abnormal cell changes. And alcohol, even in moderate amounts, is a proven carcinogen. According to the American Cancer Society, women who drink more than one alcoholic beverage per day face higher risks of several cancers, including breast and gynecologic cancers. Nutrition is one of the most powerful levers you can control. Diets rich in fruits, vegetables, whole grains, and lean proteins provide antioxidants and fiber that reduce inflammation, support hormone balance, and strengthen your immune system. On the other hand, frequent consumption of processed meats, sugary snacks, or refined carbohydrates feeds the very conditions that cancer thrives on. Think of your body as a garden. When you water it with whole, colourful foods, it grows strong and resilient. When you neglect it with poor nutrition, weeds take over. Exercise plays an equally important role. The American Heart Association and the National Cancer Institute recommend at least 150 minutes of moderate physical activity per week, about 30 minutes a day, 5 days a week. Regular activity not only helps manage weight, but also reduces levels of insulin and estrogen, lowers inflammation, and boosts your immune system's ability to detect and destroy abnormal cells. And exercise doesn't have to mean running marathons. Walking, swimming, dancing, yoga, anything that gets you moving can be powerful medicine. Alcohol, unfortunately, is often underestimated. Many women believe a nightly glass of wine is harmless or even beneficial. While some studies link small amounts of red wine to heart health, the reality is that alcohol of any type increases cancer risk. It damages DNA and interferes with your body's ability to repair cells. If you choose to drink, limiting intake to no more than 1 drink per day, and ideally less, is the safest path. I often tell my patients, treat alcohol like dessert, something to enjoy occasionally, not daily. I recall a woman in her early 70s who came to me asking how she could reduce her risk after her sister was diagnosed with ovarian cancer. She admitted she rarely exercised, enjoyed several glasses of wine each week, and ate mostly packaged foods. Together, we created a simple plan: walk 20 minutes a day, reduce wine to weekends only, and add a serving of vegetables to each meal. 6 months later, she had lost weight, felt more energetic, and told me, "I feel like I'm finally working with my body instead of against it." Her story shows that even in our later years, small lifestyle changes can produce big protective benefits. So let's bring everything together. The 5 habits that increase gynecologic cancer risk after 50 are ignoring abnormal bleeding, carrying excess weight, smoking, skipping screenings, and neglecting healthy lifestyle choices. Each of these habits alone raises risk, but when combined, they create a much greater danger. The hopeful truth is that each habit can be changed. By paying attention to your body, making gradual improvements to your diet and exercise, quitting smoking, staying up to date on screenings, and addressing warning signs early, you can dramatically lower your risk and protect your health. As women, we often put others first and push our own health to the side. But I want you to remember this: your life and your health are worth protecting. Every small step you take toward healthier habits is not just an investment in yourself, it's also a gift to your family, your friends, and the people who love you. You deserve to live with strength, confidence, and peace of mind. Thank you for spending this time with me. If this video has been helpful, please leave a comment and share which habit you're most ready to change. Your story could inspire another woman watching. Share this video with a friend or sister who might need this message. And if you haven't already, subscribe to Elder Care Wellness so we can continue this journey together. Remember, cancer prevention isn't about fear, it's about empowerment. With knowledge, awareness, and healthier habits, you have the power to protect yourself and thrive.